Awesome. Judges, we're so incredibly grateful to have you here. And now it's time to move to our pitch competition. Get excited. Right? Maybe a round of applause a bit for the pitches here. So stoked. It is my overwhelming pleasure to be able to introduce to you Nicolette Driscoll. Nicolette is the CTO of NeuroBionics and is here to pitch today on behalf of her team.
My name is Nikki Driscoll, and I'm the co-founder and CTO of NeuroBionics, where we are on a mission to simplify neuromodulation therapy by providing deep brain stimulation without the need for invasive brain surgery. I'll wait for our slides to show up here. Nope. There we go. Okay, here we go. So deep brain stimulation, or DBS, is a life-changing therapy that's used to treat conditions like Parkinson's disease and epilepsy. And it's incredibly effective. This is unfortunately a still frame from a video that normally shows how it can completely eliminate the tremor in a patient with Parkinson's disease. The problem with DBS, however, is that access to this therapy is severely limited because the procedure to implant this device, which involves drilling a hole through the skull, sticking a rod of electrodes into the brain, and then tunneling a lead wire under the skin to a pulse generator that's placed in the chest. This is so invasive and risky that less than 1% of the patients that are eligible for DBS actually opt to receive it. And so we saw this problem and we started to ask ourselves, what if there was an easier way to access the brain? And it turns out that there is one. Interventional radiologists place devices like stents deep into the brain without a craniotomy all the time. And they do so by using endovascular catheters that are guided through the natural highways into the brain, which are the blood vessels. At NeuroBionics, we're developing a device that can be guided through the twists and curves of the blood vessels and deployed from a standard neurovascular catheter. After it's deployed from the catheter, our device forms a coil inside the blood vessel, and from there, the electrodes stimulate the brain tissue through the blood vessel wall. To make this possible, our team has developed flexible, multi-material bioelectronic fibers that are as small as a human hair. I'm actually holding one right now. You might not be able to see it. That's kind of the point. This device is flexible and contains multiple microelectrodes for recording and stimulating in the brain. And our team has been developing this technology at MIT for over a decade. We've refined and extensively tested it in preclinical animal models, leading to numerous high-impact publications and patents that we've now licensed out of MIT. Okay. Clicker just died on me. Try the other one. No luck. Okay. Can the AV person advance the slide? Thanks for bearing with me.
Apologies for our technical difficulties. Would you rather start from the beginning? We can like reset.
I can stay there. That's fine.
Whatever you prefer.
Yeah, I'll jump back in.
Also very cool technology, right?
Could all admire this little hair.
Super hard to go first when all this stuff gets figured out. So thank you, Nicolette, for being.
Had to be the first guinea pig.
Right. I would suggest you be a pilot customer for this, but I think there's some medical needs.
I hope none of you are the pilot customers for this.
But like super cool, right? Okay.
Here we go. All right.
Is your clicker good?
Yes, this is right where we left off. Okay. So compared to the other players in the DBS space, ours is the only technology that allows stimulating deep brain regions without a craniotomy. The only other player that offers endovascular access into the brain is Synchron, and their device is too large to reach the small vessels in deep brain regions, which is why they focus on recording from large vessels on the brain surface. So among all the applications of deep brain stimulation, we've identified stroke rehabilitation as a particularly promising first indication for us to focus on for a number of reasons. This is a huge unmet need. Stroke is the leading cause of long-term disability. There are over 800,000 new stroke victims in the US alone every year, and over 50% of stroke survivors are left with a long-term disability. Recently, clinical trials have shown that stimulating a particular region in the cerebellum, not the area where the stroke occurred, can actually help these patients regain more motor function during their physical rehab after the stroke. And there's a vessel that goes right to this target brain region. This is also an application where we can have our device implanted and stimulating for a period of just a few months rather than years, which is the case for conditions like Parkinson's disease and tremor. And this lowers the regulatory risk and the time to market for our device. In terms of our path to market, our device will be a Class 3 medical device, which will require pre-market approval with the FDA. We plan to begin our preclinical animal studies in animals this summer, and we plan to apply for breakthrough device designation next year, ahead of our first in-human studies, which we're targeting for 2026. We anticipate being able to launch our first clinical product, which will focus on stimulation in the cerebellum for stroke rehab in 2030. And importantly, we can leverage existing codes for insurance reimbursement for our device and procedure. So today, less than 1% of eligible patients get DBS therapy. And this already represents a $1.2 billion market with a 14% CAGR. With our technology, we're making DBS safer and simpler, serving the remaining 99% of patients and substantially expanding this market. Focusing on stroke rehabilitation as our first indication, this already represents a TAM of $4 billion. To achieve our vision, we've assembled a world-class team of engineers, material scientists, neuroscientists, and Sloan students from MIT. And we are supported by leading neurosurgeons who are key opinion leaders in deep brain stimulation, as well as experienced business advisors hailing from Medtronic, Covidien, and an endovascular technology company. I really want to thank the organizers for giving me the opportunity to be here to share my vision with NeuroBionics. If our mission resonates with you, please get in touch. Thank you, and I'm happy to take questions.
You guys are welcome to just jump in. Go for it.
I was going to ask a question about the FDA approval. Can you delve into that a little bit and just sort of explain what's involved and what are the risks there?
Yeah, absolutely. So we're a Class 3 medical device. So what we have is a good chunk of preclinical experiments that we do in animals first. First, the endpoints are showing safety, that we can deploy our device, implant it, and stimulate safely. And then secondary endpoints are, can we actually effectively stimulate the brain region that we need to? So we're running those experiments starting this summer. There's also some additional biocompatibility tests that we'll be running, especially because we're placing this in blood vessels and showing that we won't be causing any sort of thrombosis or clotting. So that's our kind of preclinical safety experiments. And then we begin a pilot study, which is a small cohort, first in human. And then there's a pivotal study, which is usually more like 20 to 50 patients before you apply for pre-market approval. So that's kind of the pathway for a Class 3 device.
Hey, Nikki, you had a competition slide and you mentioned that there's one main competitor. They're a little bit bigger, but there's a lot of folks trying to bring something in this world to market. What are the main decision points that your customers are looking at for who they're going to choose and why?
Yeah, that's a good question. So the only competitor that has this endovascular approach in the brain is actually focusing on a completely different application. So they're doing recording in the brain to help people with paralysis control computers and other assistive devices. They can't actually do stimulation. So we're focusing on a very different endpoint, doing stimulation for therapeutic applications, and they're really focusing on recording. And the reason for that is because they're limited in where they can actually access in the brain. And as the name implies, deep brain stimulation, you actually have to get very deep into the brain, and they actually can't get there with their device.
Hi, how much do you expect to need for each stage of those next proof of concept and the various stages until you're able to bring it to market?
Yeah, that's a great question. So we're raising a pre-seed $3 million, which will get us through our preclinical studies and basically our first application to the FDA for our IDE or investigational device exemption for the first in human first study, we'll need about 15 million to get through that first clinical study in humans. And then for the second phase, which is the pivotal study, we'll need more like $30 to $50 million to get through that phase. So the total all in to get a class 3 device to market typically ends up being between 50 to $70 million.
Excellent. So that's 2 minutes. Give it up for Nicolette, please. Thank you so much. And a real special thank you. I also don't think it would be an MIT event if some technology didn't fail. So really appreciate, that was a joke, you guys are supposed to laugh, but really appreciate you going first and having us getting started there. Our next up contestant will be Scarlett. She's the CEO of Mithril Technologies and is presenting on behalf of her team.
Clicker.
Yep, clicker is right here. All yours.
Hi, everyone. I'm Scarlett. I'm the CEO of Mithril Technologies, and I am here to talk to you about a very new kind of, I'm sorry, Nikki, your tech is incredibly cool. Okay, there we go. All right, so I am here to talk to you about a new satellite antenna technology that stands to change the game for a lot of different applications. And we're very excited about this because we enable so many new capabilities for antennas in geosynchronous orbit, which currently not a lot of people are doing, but we're foreseeing a world where we really need to develop that tech as a hedge against the current excitement about a lot of stuff going into low Earth orbit. So at the moment, we kind of have a few gaps here in satellite antenna technology. There's a type of deployable mesh reflector that we're actually looking to improve on that's used in geosynchronous orbit. But the existing version, it's been around for 40 years and no one's really updated it. It's got very limited ability to steer and focus, and this constrains its application. And then there's some very cool, super flexible phased array antenna tech that's being updated all the time for low Earth orbit. And it's great, but it's really not super practical for a lot of geo applications. And as I said, this is going to be an area where it's very critical that we improve it. And specifically for weather sensing. Now we've got a bunch of applications, but this one is near to my heart because my grandparents live in South Florida. And at the moment, we do not have a way to use satellites to continuously monitor the internal structure of hurricanes. We don't. It is actually a very serious problem. We've got satellites in low Earth orbit that can go penetrate the whole depth of the atmosphere, but they've only got very limited coverage. And then we've got satellites in geosynchronous orbit that can cover a whole area for a long time and only the top layer of clouds. And this is not going to be sufficient for climate aggravated storms. When Hurricane Otis hit Acapulco last year, it absolutely devastated it because it went from a tropical storm to a Category 5 overnight. I'm going to skip that slide. But our enabling technique is actually really simple. I showed you that deployable mesh reflector before. All we do is we add a command surface that is parallel to its flexible mesh reflector surface and apply a bias voltage across it. And then we use that to move it around almost any way we want, control it on orbit actively. This is very simple. This is what happens when you hold a statically charged balloon near your hair. And it was originally proposed at MIT some 40 years ago, but it's only recently that my co-founder in his lab has been able to develop this a little bit further. And I spent a lot of time in MIT Aero Astro, and we got so excited about the potential for this because, bear with, there's a lot of text, we're working on that, but not only can we address hurricane monitoring and forecasting because we break all these trade-offs that limit the ability of these devices, we also make satellite communications more flexible. We have the ability to null out signals and detect other signals by scanning large areas and focusing in on them at the same time. And that has applications in the space and defense and intelligence communities as well. We are filling multiple gaps that no one's been addressing for years because they've just not had the imagination. So just to introduce the team, we are a very new startup, and my co-founder was Professor Zach Cordero of the MIT Aerospace Materials and Structures Lab. I have made my whole career in the space industry, spent some time at MIT AeroAstro, eventually made my way to the West Coast and started applying that for 5 years at SpaceX and NASA JPL. Came back to MIT for the Leaders for Global Operations, so I'm on the tech side and the Sloan side. And we've got some brilliant advisors also out of MIT and MIT Lincoln Lab who are supporting us on this. And at the moment, we are very early stage, as mentioned. We've got a prototype that we've demonstrated this tech in the lab. And we are working now on scaling up to a 5-meter unit for some of our earliest government customers. And eventually we plan to develop a full-size unit for continuous hurricane monitoring, which we want to operate ourselves so that we can sell recurring access to the data. And that is time. Thank you very much.
Can you tell us a little more about your business model?
Oh, sure. I'm glad you asked. Oh, whoops. That I had a slide for that, but so currently the business model is focused initially on developing our antenna technologies for a hardware equipment sales model. And that's because some of our early stage customers in intelligence and in satellite communications, they want to be able to buy that and integrate it into satellite hardware. And we'll use that to fund the development of our technology for that weather sensing application, and have a separate business unit where we operate our own satellites so that we can downlink and sell that data. And we are looking at customers in insurance, insurance and reinsurance in particular, but also in commercial shipping, in disaster response and preparedness, and also actually with the government as well, because they are looking to protect their seaborne and coastal assets from storms that currently they can't see.
So quick question. So in terms of kind of expanding on the business model and how you're, so are you using some sort of imagery to be able to expand into all these different markets and having to add, or is it just this one technology that's able to scale and do, like, for example, shipping and these various industries? I mean, do you have to build out a constellation of these various devices or geosatellites in order to be able to have the coverage you need for like a big global shipping?
Oh, okay. Yeah, that's about 4 questions. Thank you. So actually good Lord. So actually the brilliance of operating in geosynchronous orbit is that you can achieve a lot larger of a scan sector of the Earth than anything in low Earth orbit. Because of our steering capabilities, we actually expand that still further. So we can cover a sector continuously. At the moment, our analyses show about 7,000 kilometers across. So we will ideally launch multiple satellites to achieve full global coverage. But once we even have one in orbit, we already start delivering value that other people can't. We just point that at Hurricane Alley, and we've already got Swiss Re very interested in our data.
Hi, what's your process for keeping competition at bay or for recreating your technology?
Okay, so I am glad you asked that one as well. So we have a patent that is pending on this specific actuation technique. And make no mistake, other people have been trying to develop other types of actuation technologies for a few decades, and they've really struggled with that. And because we have that patent, we are expecting to be able to protect that because it's coming through MIT. Most of our nearest competitors are not likely to replicate the same instrument. They're probably going to try and replicate the same capability with a large constellation of LEO satellites. But we do anticipate that they're going to struggle with that because there's a lot of satellites that we're trying to put into low Earth orbit right now. It's getting very crowded up there, and you have to launch a lot of satellites to achieve the same kind of coverage that you can with GEO.
And that's time. Scarlett, thank you so much. I'll grab your clicker. Thank you, thank you. Thank you for your amazing presentation. I always feel like I get a lot smarter with these. It is totally recommended to Google things as you go, just to get a feel for what's actually happening, which is generally what I do at MITFS. So next up we have Denzil, who will lead smarty.ai. She is the CEO of smarty.ai Inc., and she's here to present on behalf of her team. Thank you.
Hi, everyone. My name is Denzil, and I'm working on Smarty, the AI way to power through your workday. So today, more than 55% of your time, the corporate knowledge workers' time, is wasted on easily automatable tasks. On top of that, more than 30% of your time is spent on tasks that have low value for your business, could have and should have been delegated. Unfortunately, the solutions out in the market today don't actually solve your productivity problem. Hiring and managing an executive assistant or a virtual assistant takes time, energy, patience, and a lot of money. Even virtual assistants are about $10 to $30 an hour, and it's often easier, faster to do something yourself than to train someone else to understand your personal preferences and your needs. That's why there's been a huge explosion of productivity and future of work tools today. But unfortunately, most of the tools that are out there only optimize one workflow. Superhuman for email, Calendly for scheduling, HubSpot for CRM. Right now, there's no tool that has solved that all-in-one consolidated value proposition. Unfortunately, users today have higher expectations than ever. Professional consumers or prosumers understand what is possible with technology and automation today. So they're demanding smart tools, tools that manage and complete annoying tasks for you, tools that understand natural language requests, tools that provide personalized recommendations, that understand your preferences based on your past data and actions. And that's what Smarty does. Smarty is an AI-powered executive assistant in the form of a conversational calendar. Today, we're targeting solopreneurs, small business owners, and freelancers who need a single universal inbox in order to capture everything on their plate so that they can plan their best day every day. Let's look at Alice. Alice used to be the marketing director at her old company and has now started her own marketing agency. She used to have an executive assistant that had been with her for several years and was dedicated only to her. Today, she doesn't have the time, energy, or money to hire and train a new executive assistant. And she doesn't trust virtual assistants because she's had quality issues. So she's really looking for a tool that empowers her to be faster, better, smarter. Today, she was band-aiding multiple tools together, which meant that she was constantly context switching, using 5 or 6 different tools to do a single workflow. Because of that, she was dropping the ball and missing opportunities. And so she found Smarty because she wanted a tool that empowered her. Today, using Smarty, if Alice gets a meeting request from a client, she can easily set up time with her client for her and her coworker by saying, next Thursday and Friday with Kimmy, strategy session, and Smarty will automatically paste in the mutual availability for her and her coworker for next Thursday and Friday with a single command. No switching to a different calendaring or scheduling tool, no figuring out her coworker's schedule. It's a single command, and this is live today in Smarty. If she needs to set up a meeting with her coworker to prep for this meeting, she can say prep strategy session with Kimmy, 2 hours in the afternoon before next Thursday, and a calendar event will be auto-scheduled into her calendar and Kimmy's calendar before next Thursday for them to prep for this client meeting. That event will be associated with this email, and done. She can archive this email with keyboard shortcuts. We support all of your favorite keyboard shortcuts from the productivity tools you might be aware of today. And that's just 2 conversational commands for scheduling link creation and calendar event creation. But today, Smarty already has natural language commands automating workflows in brain dumping tasks and auto scheduling them into your calendar based off deadlines and priorities, creating emails based off your templates, managing your contacts, creating notes. And Smarty supports multiple calendar accounts and multiple email accounts all in this one universal inbox. So for someone like Alice, who's spending 80% of her time managing the work she needed to instead of actually doing that work, direct quote, she now uses Smarty so that she can spend the majority of her time on the actual business services that her business provides. The way that Smarty works today is that we are really at the core of it an API hub. We take every API that we're integrating into Smarty and understand how it integrates with all of the other APIs. APIs are languages that digital software use to talk to other pieces of digital software. At Smarty, we understand how these different APIs connect to your user data. We provide a single interface that is minimal in the form of a familiar calendar experience, and we create natural language commands on top of it. We're adding more natural language commands every day. And for the future of work tools opportunity, it is a multi-billion-dollar global opportunity. Just in the United States, future of work tools built on top of G Suite or Microsoft 365 is a $25 billion industry. And as I mentioned, we're targeting solopreneurs, freelancers, and small business owners. And just freelancers in the United States are 59 million Americans, all actively looking for tools that empower them and make them better at their jobs. We're starting off really simple with a 7-day free trial and a $10 a month premium model to keep our price low as we iterate to awesome. And our users today fall under these 3 major buckets. We started charging our customers earlier this year. We're retaining 70% of our customers, paying customers month over month, and we're projecting a 240K ARR by the end of this year. And the reason we're growing so quickly is because Smarty is inherently viral. Every time you send a calendar event, an email, or a scheduling link with Smarty, it says sent with Smarty. But we have a larger marketing and go-to-market strategy using owned media, earned media, and we're starting to get into paid ads. The reason that we have such a great marketing strategy is because our advisor used to be the head of marketing at Trello and wrote the playbook on product-led growth. We also have some great investors on our team. And our team is small but mighty, shown here. Everyone's technical, including me. I'm course 6 from MIT. And I also went to Harvard Business School. In between, I was at Microsoft, always in the enterprise productivity space. That's my passion. And I thank you all for listening to me. And my 3 major asks for you today is go try Smarty. Everything I showed is live. Connect with me on LinkedIn. Happy to walk you through the product, and to connect me with any productivity influencers that you know. Think Cal Newport, Meter Isle, but even micro influencers, and plan your day with Smarty. Thank you. I'd love to open it up for questions.
Have you talked to consumers for their feedback, and what have they said?
Yes, we have paying customers today. They fall under the main categories of small business owners, freelancers, and solopreneurs. And we're saving our customers hours every week. Every workflow that you can run through Smarty saves you for every hour of work. We are helping you do it in a few minutes.
So you said you worked at Microsoft, and of course they have this big initiative around Copilot and agent technology, and of course AWS App Fabric. So in terms of sort of the confusion out there in terms of all these workflow tools, are you finding that the noise from Copilot or these other applications is sort of making it a little bit more difficult to sell, or is it not confusing at all?
Not at all. So actually, a lot of these tools have APIs of their own. And so we actually integrate them right into Smarty to make our technology even better. And then we have our own core algorithms that we're also using to continue to keep our tech as cutting edge as possible. And so really, we're more of like this layer on top of the work tools that people are using today, like Notion, Gmail, Google Calendar, and all of the AI APIs that are out there. They're helping us be smarter.
Great presentation, Denzil. How have you gotten your first chunk of users, and how has the growth mostly happened since those first users came on?
Yeah, that's a great question. So we have been working on Smarty for a few years, and we've actually grown a community of over 8,000 Smarties. And so we've been just working with them. That started through creating partnerships with business coaches who create classes for freelancers and using Smarty in those classes, or from creating a landing page with a wait list and just driving ads to it. And so we've done a great job of developing the community around us. And now we're growing pretty rapidly as our users use the product and interact with other clients and folks in their own network.
Awesome. Thank you so much, Denzil. That was incredible. I saw some folks take some photos. I'm sure they'll follow up later. Yeah, that's great. Awesome. So next up, we have Bettina. Bettina, you can grab your thing here. Bettina Eden is the CEO. Bettina Hein, I apologize. Bettina Hein is the CEO of Juli, and she's here representing her team. Thank you.
I'm a repeat entrepreneur. Juli is my 3rd company. I've built 2 prior $100 million companies. When I was building my 2nd company, what happened was that I just raised the Series A, and I was heavily pregnant, and I fell on my way to work. and I had a preemie. Very unexpected. My daughter came, and from that day on, I couldn't sleep. And that was hugely traumatic to me, and nobody would help me. My PCP at Mass General said, "Are you stressed at work?" And I said, "Yes." What I meant was, "No shit, Sherlock, I'm running a Series A company, and I have a child whose breathing has to be restarted." And so this was 13 years ago, and I grew my second company to 100 million in revenues, and I took a 2-year break. But from that experience, I learned that the only way I could improve my health was to help myself. And I did that by taking data and hacking myself back to health. And I wanted that for people with chronic conditions like myself. So our healthcare system is really strained to a breaking point. Over 50% of Americans have a chronic condition, and 50% of those have more than one. 90% of healthcare costs is spent on chronic conditions, the $4 trillion that are spent every day. And that's why we need Juli. Patients want to help themselves, but they're not empowered to do that. Digital solutions that are out there right now are not engaging. They're boring health portals, and there are a million solutions out there that, as point solutions, really create fatigue. Providers are burnt out, and they are losing revenue. They are producing higher costs because digital health isn't working. That's why I created with my team Juli. And this is how Juli works at the example of Emma. Emma has migraines and she has depression. She really tries to identify what she can do. And when she discovers Juli, Juli helps her identify her triggers and her patterns. That information goes not only to her, where it says, do some more activities, don't go outside when there's high air pollution. She volunteers to walk her neighbor's dog, and her care team gets insights. Juli nudges Emma to keep going, and her depression improves and she has less migraines. How does it work? We gather data from 5 different sources, from smartphones, from watches, environmental data like air pollution or pollen count, and EHR information, and patient-reported information. We identify patterns, and we have a gamified way of coaching people to better adherence to their treatment regimens and to healthier behavior. And this here is not just for the patient, but it's also integrated into healthcare provider workflows, into the EHRs via FHIR, which is now mandated by the US government as a exchange format. We have shown across 2 randomized trials that Juli works. We've shown it in depression, and we've shown it in asthma, where we showed statistically significant improvement in outcomes with patients using Juli versus an active control. We've been able to create 10 conditions so far, and we really can expand those very quickly within weeks, depending on our customers. People really love what we're doing. Health apps are not popular, as I mentioned. We are able to have a 7x retention compared to the competition. We've reached some really important milestones. Over 32,000 patients have onboarded onto Juli. We have a 4.7 in the App Store. We've completed these clinical trials. And at the beginning of this year, we signed our first 7-figure pharma contract, where pharma companies pair us with their medications. And next, and that's why I'm here raising new money, is that we want to roll this out in value-based care to help lower the cost of US healthcare. Thank you very much.
Hi, and so is this a subscription model paid for by the user, or is this going to be paid for by doctors or your customers to doctors, the pharma companies, who will then provide it for free to the users?
So no, actually, any one of you can download Juli right now off of the App Store. It's free. We give it to patients to use for free. Who pays us are pharma companies that pay us per month if they pair it as a companion with medication, or if for payers, so health insurance companies that use it for their chronic condition management programs, where they also pay a fee per user per month.
And do you have traction with health insurance companies? And do you have traction getting into any EHRs yet?
So we are currently integrated into Epic, which is the leading EHR, working on Cerner. We are in conversations with health insurance companies. Our first traction, actually signed contract, has been in pharma, which is in itself also a pretty large market, because we are looking at ADHD, hematology. There are so many ways that Juli can be used across conditions, not just those 10 that we've done.
You mentioned that the retention is 7% higher than your competitors. So can you elaborate why you think you're retaining the consumers?
We have a pretty radical concept. Lots of people say you need to have long app sessions, keep people in for a long time. We make our app purposefully super simple. We want you in and out in 90 seconds or less, and form a habit. So right now our users are in for 77 seconds a day. We do the rest passively because we collect over 95% of the information passively, and that we deliver then that value in a very consumer friendly way. The reason I can do that is that I have a fabulous co-founder who's done nothing but consumer marketing. Her name's also Bettina, so we're a two Bettina company. She's done that for a quarter century, and I have other people on my team that have designed healthcare products for consumers, where we are really honing on that retention.
Awesome. Thank you so much, Bettina. I love a good action step at a pitch, right? So that's fantastic. You can leave that there. Thank you. Next up, we have Anne Carpenter, who is the co-founder of SyzOnc. Welcome, Anne. We're super excited to have you.
Science has brought some amazing breakthroughs in cancer therapies, but they've only benefited some subset of patients. Sorry, I guess the slides are a little messed up. I'm sorry.
You can go back.
Yeah, maybe I should. For some tumor types, however, there are really dismal survival rates, and they include the ones that are shown here. These are solid tumors where there is typically no medicine that a doctor can give you. Typically, they cut the cancer out, maybe amputate a limb and give you radiation, and that's all they can do. Now, there was a lot of excitement when immunotherapies came out, CAR T cells and checkpoint immunotherapies. But again, for these types of cancers, these solid tumors, they fail to respond to them. I'm Anne Carpenter. I'm an institute scientist at the Broad Institute of Harvard and MIT. And together with my co-founders, we really want to change the face of these kinds of cancer therapies for these types of really devastating cancers for which there's no other options. Now, it might surprise you to learn that these kinds of cancers have one biological mechanism that's in common. In fact, immunotherapy response also shares this mechanism, and that's the extracellular matrix, the ECM. So you'll have to learn that term today. The extracellular matrix hinders a lot of cancer treatments, and our solution is to treat tumors as the complex ecosystems that they actually are. And the ECM is hindering these cancer treatments by several different distinct mechanisms. First, drugs can't physically get into the tumor because it's a solid tumor surrounded by this dense protein network of the matrix. Secondly, the matrix is trapping immune cells outside of the tumor so they can't physically get into place. Immune cells normally would attempt to try to kill the tumor before it grows too large. And lastly, the matrix is stopping immune cells from working properly. Even if they navigate into the tumor, there's signals sent that stop them from working. We want to successfully target the ECM using some creative approaches and some specific expertise. So if you want to know our competitive advantage, that's really it. It's our know-how in this field. Myself with machine learning and drug discovery expertise for the past 20 years, as well as my co-founders who are focused on oncology. Our approach is this integrated tech-enabled cancer platform where machine learning meets wet lab research. My co-founders at Penn School of Medicine identified druggable ECM mechanisms. Myself, my expertise in AI tools is accelerating drug development by identifying compounds faster and cheaper. And that just makes predictions of which compounds might work. Then my collaborators, my co-founders, will validate compounds in their comprehensive tumor ecosystems. I'll really quickly look at these three pillars of our strategy. First, identifying ECM mechanisms. My co-founders, Dr. Zeisinger and Fuller at Penn, have dedicated their lives to studying sarcoma as well as the tumor microenvironment and this ECM. In particular, their response to immuno-oncology. So it turns out that ECM has been well known since the 1940s to be really important for developing cancer medicines. And yet it's only recently that there's a cumulative knowledge in this field, some developed by my co-founders, that have given us some footholds into some mechanisms that we think will be druggable. That brings us to our second pillar. That's my expertise in machine learning. The research from my lab has already served as the foundation for a public company, Recursion. This is my first company that I'm starting myself. And in fact, this is my first pitch competition. And we aim to bring the validated AI tools, partly that I've developed, but also what's out there and available to the world, to build what I'd like to think of as a full stack AI drug discovery company. So I'll just zoom in on one example really quickly where we take first these cells. So you see a picture of cells here. We've perturbed a gene called YAP1 that is known to be involved in ECM modulation. Then what we do, well, you look at the image, they look like pretty normal cells, even to an expert, but the computer is extracting numerical measurements from those cells. And what we can then do is go look up in a database of existing profiles from similar images where cells have been treated with drugs, potential drugs, and we see if there's any matches. So instead of physically testing millions of compounds in an experiment that costs millions of dollars, we can identify just the cream of the crop, maybe 30 drugs that look like they'll influence YAP1 and take those on to wet lab testing, which brings us to the third pillar. And that work, by the way, is computational. It takes an afternoon. The third pillar is validating these compounds in tumor ecosystems because our predictions are only predictions. We need to test that they really work in a context that most resembles an actual patient with a solid tumor. So again, many assays that this group has developed, but I'll focus in on one, the tumor ecosystem in a dish, where the cancer cells are placed, ECM is secreted by the cells, and then immune cells are placed, and we check to see if the compounds actually work in this context, giving them the most likelihood to work in clinical trials. So I'm not pitching a charity to cure cancer today. It's a business, and our goal is to start with sarcomas. But many of these other types of cancers are very matrix rich as well, and collectively they form a very large global market of over $75 billion. So that's it. We're currently raising our Series A, and our goal is to launch in a couple of weeks, opening our lab space, bringing in our CEO, starting to raise this round in order to take a couple of compounds that look promising from our academic work and push them along in program one, a couple more programs with different ECM mechanisms, and then build out our platform. SyzOnc is going to bring the most advanced biological and computer science AI tools developed in our laboratories to develop the next generation therapies for devastating cancers. Thank you.
Awesome. So how difficult is it to actually access these tumors? Because I think in precision medicine that's been a little bit of an issue to be able to get the DNA of a particular tumor to be able to predict what the best outcomes can be.
Okay. So yeah, now you're thinking about the how do we know, I think the question is basically, how do we know which tumors will be most responsive to which therapies? And there's a number of approaches that can be taken to look for biomarkers that are appropriate. For example, if we have a program that's targeting YAP1, as we currently do, we can look for the levels of that protein that are present within a tumor, and you can do that at the protein or the mRNA level, which is relatively straightforward to do in clinical care these days. But there are a number of other ways to try to stratify which types of cancers are going to be most responsive.
So it isn't really an issue getting the tissue out of these tumors to be able to do that, or?
The first step is always surgery to remove these kinds of tumors. And so that material is available for testing. So there is a potential for a companion diagnostic. It may not even be necessary, however. It may just be that, that for a particular class of cancers that can be diagnosed and stratified in a just with normal clinical tools like pathology, typical pathology, will be sufficient to tell us which cancers are going to be tractable.
Are you looking to develop the drugs and bring them to market yourself, or are you essentially a business that's hired by pharmaceutical companies to help them develop these drugs?
We definitely want to be a drug discovery company ourselves, and so the typical route that you would path that you would follow is to bring drugs, candidate drugs, to the point where there's enough evidence that it warrants investment by further capital. Sometimes there's partnerships together with a bigger pharma that has a big marketing arm and so on. But either way, our mission is to make the drugs ourselves.
So what does the timeline look like to be able to get that, to get to that point where you're actually going to get?
Can answer this
funded?
really quickly.
The timeline for getting to the point of getting drugs to IND enabling, which is an FDA step, will typically take about two years for the programs that we have underway.
Awesome. Thank you so much, Anne. Join me in giving her a round of applause. And thank you for letting us be your first pitch competition. We're so honored to have that title. Next up, we have Claire, who's the CEO of Ergo. Thank you, Claire.
Hi, everyone. So can you raise your hand if you have ever bought something online? And then keep your hand raised if anything you've ever bought online felt a little expensive. Okay, perfect. So you've just answered the first question for our judges, which is that our total addressable market is 100% of everyone. Kidding, sort of. But really what you demonstrated is that you have experienced one of the major problems facing commerce today, which is inflation and how high it's been. But there's a lot of other problems that the businesses are facing. So they're sitting on a lot of inventory that they don't know how to get rid of, and some are resorting to unsustainable practices. And then on the demand side, to put it simply, they don't know how to price. And so when you look at this whole picture, you might start to think that commerce is broken. I am Claire Stepanek. I am the founder of Ergo, also an MIT alum. And I founded Ergo to solve all of those problems with one tool. So let me show you how it works. We're currently live. This is a website that you can go to today. So you're online shopping. You love this pair of skis, but they're $799, and that's just out of budget. So you scroll down, and now you see a new button that you've never seen before, and it says make an offer with Ergo. You click on it, and a modal appears, this pop-up. And you fill in how much you're willing to pay and how long you're willing to wait to get the skis. And then you put in your information, and that's it. It's super simple. Now you might be sitting here being like, I love it, except I don't really shop that way. That doesn't feel natural to me. So let's do a quick history lesson. In 50,000 BC, we see the start of commerce with these ostrich egg shell necklaces. And then we see widespread commerce in 700 AD with the Silk Road. And for that entire 50,000 plus year period, everyone was shopping exactly how Ergo works. You say, hey, I'd like to pay this much. And the seller says, okay. And that's it. But all of that stopped in 1995 with the start of e-commerce. So what we're doing with Ergo is we are taking this behavior that is so human and using technology online. And simple negotiations are a very big passion of mine because I've seen the power of negotiations. My background is that I spent 5 years at Apple leading the supply chain team that made products that flow into the iPhones and the Macs that you use. So there was a lot of negotiations in that role. And really the most effective negotiation style was saying, hey, this is what we want to pay. And the other side saying yes or no. And then when I was at Apple, I went out and I decided to buy a car using the same strategy. So I said to the dealership, this is how much I want to pay. They made me talk to a lot of people, but at the end of the day, I left with the car at that number. And that's when I realized this concept, these learnings that I'm getting from Apple can apply in a direct-to-consumer environment. And that was the start of Ergo. So hopefully I've convinced you by now that as a consumer, this is great for you. You save money. But what about on the brand side? And so if we go back to those problems that they're facing, there are tools they can use to clear inventory. And there are tools they can use to lower their price or lower the price in the case of buy now, pay later. But what Ergo is doing is we're playing in a new space where brands actually get something back from putting something on discount. And the data they get back is phenomenal. When people talk about AI, one of the biggest problems is data. But we have data of, hey, I want to pay this much, and I'm going to prove that I mean it because then I went and checked out at this price. So Ergo is able to leverage all the data from all the brands using us and turn that into a pricing engine. Now the question might be, are brands actually going to pay for this? So this is our pricing model. You can also see a summary of the data table we show brands. We initially launched as a Shopify app. And so we take 3.99% on every transaction that goes through Ergo when someone checks out with their offer. And then we did launch with a free tier, but we also, to get the data or any of the actionable insights, you have to start to pay. And so that starts at $49.99 a month. So now you might be wondering, is anyone actually using this? Well, since we launched in September, we have grown 200%, and now we have 15 brands using our software. We have 100% retention, and we also have a 5-star review in the Shopify App Store. So if this is what we could do in 6 months, what can we do in 5 years? I think this button is going to be on every website when you are online shopping. And why would a brand ever put something at 50% off when they could use the Ergo button and make more money from the offers coming in and get all that data? So how are we going to do this? Well, you've all met me. This is my awesome team. So Vidya, Charday, and Jenna, we're small and lean, but already getting great results, and our existing investors, Anthemis and Wishoff Ventures. Thank you. Thank you for having me. You obviously can reach out and then, oh, thank you. I'll take it. We'll just end there.
Claire, what are you seeing as far as the impact to the end price to the brand? Are they selling it at 10% less most often? Like, what are you seeing there?
Yeah, so right now, the numbers vary. And it depends on if the brand is using it as something that's like already on sale versus putting it on 100% of their products, since we have brands using both. But really what we're seeing is it's hard to quantify because they accept the offers. So no matter what we're seeing, they're seeing better rates than if they had put it on sale because they're accepting ones, which means they're making more money, if that makes sense. But right now, roughly 70% of offers are getting accepted, and they're at about 50% off with something that's already on promotion, 25% off if it's just sitting there on something that's not on promotion.
So I love your enthusiasm. But in terms of the products, I mean, what is like the price point? Are they more commodities, or are they bigger ticket items that that are being pushed through by these brands?
Yeah, huge range. So we are on skincare products that are $12 a bottle, and the promotion you saw with the skis is an $800 pair of skis. So truly the huge gap between them.
What is required for a brand to work with you? So like, do they just download something, or what's required?
Yeah, so we launched as a Shopify app. So for brands that built their websites on Shopify, there's an app store similar to like an app store for your iPhone. And so they can download it from there. They literally click it through. They select which products they want to put Ergo on, and it's live.
Got it. And is it free for customers? As in like regular?
Yeah, exactly.
Only the brands paying.
Exactly, only the brands are paying. Yeah.
Awesome. So that's time. Thank you, Claire.
Thank you.
Incredible.
Thank you, guys.
Thank you. Thank you. Another one you guys can actually check out on the App Store. Always good to see. All right. So next up, we have Cynthia Liao. She is of Vertical Horizons, joining her team. Thank you so much.
There we go. Hi, everyone. Good evening. I'm Cynthia. I'm a current Sloan Fellow MBA student, and I'm here to tell you about Vertical Horizons and our award-winning patented semiconductor technology. Data centers have a huge problem. They are incredibly energy intensive and also highly carbon intensive. They're also facing challenges with cooling. As such, up to 90% of OpEx for data center is energy. The rise in AI and cloud computing is actually making this problem bigger, hotter, and more carbon intensive. So as data centers adopt GPUs, those require much more energy and also generate 5 times more heat than traditional CPUs. In early March, Elon Musk was quoted as saying that because of AI and EVs, the world is going to face supply crunches in electricity and transformers by next year. What if we could accelerate the data infrastructure for AI and cloud computing while driving down energy and costs and also help data centers reach carbon neutrality? We've identified that improving power conversion is a major cost and carbon reduction opportunity. Right now, silicon-based converters are very inefficient. At MIT, the Palacios group has patented a groundbreaking vertical gallium nitride device that offers unparalleled advantages for all high-power electronics. These devices are more efficient, more reliable, can operate a higher breakdown voltage, have better thermal management properties, all on a smaller device area. What does this mean in a data center? So data centers have 3 to 4 power conversion points from the utility down to the server. Applying Vertical Horizons technology helps unlock a 35% gain in energy efficiency for power reaching each server rack. That's not all. As I mentioned, cooling problem. So with less energy loss as heat, we're also able to make an impact and reduce the need on cooling. What this means for a data center is a reduction in OpEx of up to 25%, data center PUE, or power usage effectiveness, from 1.5 down to 1.3, and also importantly, carbon reductions by up to a quarter. Now, what's exciting about what we're doing is not just what it can do, but also how it is made. So when people think about semiconductors, they think about the really expensive upfront investment in a foundry. Not for us. So we've been able to develop a breakthrough fabrication process that essentially allows us to grow the gallium nitride wafer on an engineered substrate. What this means is that we're able to use silicon capacity to produce our technology, so no high upfront capex, and also lowers the material cost down by 1/3. What's most exciting is we are producing the very first vertical GaN transistors on 8-inch wafers. And here they are. This is the first of its kind 8-inch wafer prototype fabricated at MIT Lincoln Lab. Quite beautiful and used to match the colors in here, but now the colors have changed. There's an immense market opportunity that we're talking about. So data centers are our first target market because of the very obvious pain point and growing rapidly. Our second target market is EV chargers, where we've actually validated that they are looking for these higher power blocks for solid-state transformers, $4 billion, CAGR of 25%. But what's most exciting about our technology is that it's and actually can be served across all high-power electronics. So think medical devices, microgrids, other defense applications. So the TAM is actually closer to $30 billion. We are proving that we are actually much better in terms of performance, ease of fabrication costs than the incumbent silicon devices, and also the emerging silicon carbide devices. And that's not all. So we have the potential to help every data center reduce carbon emissions by 25%. For one single data center, that's equivalent to 80,000 US households. Scaled globally, that is 200 metric tons, which is about the carbon emissions of a country the size of Spain. To accelerate our product development, we are currently working under a DOE-funded ARPA-E grant, Tech to Market program with analog devices, Chromis, UCSB, and Lincoln Lab. What we're doing is we're demonstrating those initial prototypes and then also de-risking the fabrication process. At the same time, we're working closely with the customers you see on the screen to understand the pain point and also position our technology for success. We are well positioned to leverage the billions of dollars being released under both the IRA and the US CHIPS Act. So where we are now is focused on this initial de-risking of the fabrication process and producing the prototypes and developing our industry partnerships. By the end of this year, we're hoping to raise a round of funding and also get into our first pilot. After that, we hope to use that to really get to a commercial scale project by next year, which is ambitious, but we think is possible because of the huge need right now in data centers. So we have the right team to really take this forward. I myself, mid-career MBA student, 10 plus years of experience across climate energy, including as an investor and also as a diplomat to China. Sharon, Minsick, and Josh are all PhD students working with Dr. Tomas Palacios. Their research has been fundamental to the breakthrough technology I'm telling you about today. And we're also advised by a great team of commercialization experts. Thank you so much, and I'm happy to take your questions.
So in terms of the funding requirements in order to be able to start manufacturing this, I mean, I know you indicated that it was a lot cheaper. Can you sort of take us through kind of what that phase one will be in order to get these prototypes out and then start getting some sales and engagement in? Because
absolutely. So actually, for our first pilot, our ARPA-E grant already covers the fabrication runs involved for that. So these transistors that we're making can be packaged and actually put into pilot devices. When it comes to the next commercial scale, those fab runs will be quite a bit more expensive because they're happening at a larger scale, and we're still exploring some of the costs related to that. So it would be in the millions to kind of set up the entire fabrication process and then also get into the contract manufacturing phase. And that I'm talking about a commercial scale project, because each of these wafers produce dozens of thousands of devices.
You mentioned you have an 8-inch wafer. So are the competitors bigger, and how is that better?
Yeah, so we're better in many ways, and the 8-inch is one of those ways. So right now, most semiconductor fabrication runs on 8-inch wafers, and that's the most economical in terms of the number of devices you get per wafer, and also what everything else is set up to produce at. The other GaN competitors are only able to achieve 2 or 4-inch wafers, and this is really because of the fabrication process that we're doing is much more stable and quite groundbreaking. So they're actually coming to us and asking us, how are we able to achieve this? And then I think just another point on competition, there are no other vertical gallium nitride devices currently commercialized. The other technologies are lateral GaN devices, which don't have the same benefits, particularly for a data center.
One more quick question.
So if I have a data center, how ultimately would I be saving money by using your product?
Yeah, so I just want to show one slide, sorry. So in terms of the value chain, we are quite deep in the value chain. Where we are doing our customer analysis is where we think the most benefit is being derived, which is in the system. But how it would actually work is they would be buying converter devices or energy systems from, for example, a Schneider Electric, et cetera. And we would be actually integrating that technology into those devices. And so that's how they would be actually accessing the benefits. Right now, we're in the process of confirming how much value can we extract for that intermediary before we understand how we can price ourselves to those converter module producers.
Awesome. Thank you so much, Cynthia. That is time. Really appreciate it. Awesome. So next up is actually our last pitch. I know you guys have all really enjoyed this. So directly after this, we're going to be voting. So keep that in mind. It's my privilege to welcome Elaine to the stage. She is the co-founder and chief product officer for Jane Energy. Welcome.
Thank you. Hi, everyone. I'm Elaine, and I'm one of the co-founders of Jane Energy. Who here remembers their first winter at MIT? I know I do. My first winter, I lived in this triple-decker. It was old and it was full of character, but it was always freezing inside. So I tried to fix my problem. I plastic wrapped all my windows to keep the cold air out. And then I started wearing my winter jacket inside. Then I got my first utility bill and it hit me. I'm still using this much energy to heat my home, and it's costing me how much? I discovered that what I needed was an energy retrofit, some upgrades to my home, like better insulation, installing a heat pump, and maybe even solar that will make my home more comfortable and save me money. More than that, it will make my home more climate friendly, making it one of the best things that I could do for the environment. So I went online to see if anyone had done a retrofit like this before. But instead of advice, all I got were horror stories. Josh spent weeks calculating how much he would save. Shannon called contractors and got quotes ranging from $12,000 to $60,000. And Mackenzie, she had a hole in her roof for 3 days. Millions of homeowners will need to do retrofits like these. In the US, our goal is to be net zero by 2050. And to reach that goal, we will need to retrofit 100 million homes. At our current rate, this is a moonshot. Most homeowners will struggle figuring out what to do for their home and who to ask for advice. That's where Jane comes in. At Jane, we're building a climate plan for every home. Simply upload your home inspection report. Jane will then build a rich data profile for your home and come up with a personalized climate plan with potential upgrades, costs, and incentives. By pulling from public and proprietary data from technologies to weather to home energy models, Jane can guide you through any home energy retrofit. And when you're ready to move ahead with your project, Jane connects you with a contractor, making it super easy to get quotes and schedule installs. On our end, we take a 3% fee on the project. And with the homes that we need to retrofit, this represents a $100 billion market opportunity. We're going to market through real estate agents. As trusted advisors to homeowners, they're the perfect channel partner. We're already piloting with 5 of the leading brokers in this space, and we're gearing up to partner with brokerages, making them one of the biggest drivers for climate-friendly homes. And we're the right team to do it. We're an urban planner and a technologist from Harvard and MIT, and we've actually been a team for 7 years. We were both early employees at a real estate startup where we built all the analytics, from people to process to systems, to scale its 100x growth. And now we're building Jane. We've been passionately working on Jane for the last 10 months. In Q4, we ran a successful pilot with 26 homeowners. We created 17 climate plans and converted 30% of those to installs. Now we're preparing to work with brokerages, and in the next year, create 1,000 climate plans, make $1 million in revenue, and save 100,000 tons of carbon emissions. Our vision is to create a climate platform for every home. Today, we've proved that homeowners need climate plans. Tomorrow, we want to scale that to every single home. And then we want to take it one step further. Beyond just climate plans, we want to cover energy monitoring, climate resilience, and indoor air quality, making Jane a climate platform for every homeowner. Today, we're excited to share that we're taking new projects in New York. So if you're a homeowner that's interested in getting a climate plan, go to jane.energy and join our waitlist. And let us take care of the rest. We're Jane, and we're building a climate plan for every home. Thank you.
How long does it take for when someone uploads a plan? How long does it take for you guys to create the plan for the
Yeah, right now it takes 3 days. We ingest the inspection report, so that's usually in a PDF format. So we standardize all of that, and then we run that through our calculations. Right now it's just my co-founder and I, and we're going to be building out a tech team. And so hopefully the turnaround will be faster than 3 days.
Will it be automated, or will it still require people to help?
Yeah, it will largely be automated. I think creating the climate plans is very automatable. What we've noticed is that homeowners still want someone to guide them through the process. And so we've built in a customer service team or energy advisors, and those advisors will meet with homeowners for 30 minutes and guide them through what that plan means and give them the confidence to move forward.
When a customer gets a quote, how accurate are those quotes?
Yeah, so we prepare a initial estimate for the homeowner. Those are pretty accurate. Those come from our own sizing of the system. So we do our own design prior to sending the project out to contractors using very transparent methods. So for example, for solar, we run that through Open Solar. And then when we get the quotes back from the contractors, we will compare our initial estimates with what we're getting back.
And is that scalable? I mean, presumably you've got a pretty small group right now, but you want to have a very large group of users.
Yeah, it is scalable right now.
So how much revenue do you generate on a per deal basis?
Yeah, so
compared to the amount of time you're spending on it?
The average project size right now is $30,000. So typically we take a 3% fee. So we're making 1,000, and we spend roughly 30 minutes with the client, understanding their goals, and then probably an hour putting together that material.
Awesome. Thank you. That is time. Thank you. All right. Can we give it up for one last time for all the pitchers? Amazing job. I will also generally note, can we bring up the audience choice slide? Do you guys mind just grabbing that quick? I will also just quickly say that we have hit our first goal. There's just about 300 people in the audience today. Isn't that incredible? Last year's event, there was just about 200, and we had our own target kind of hitting 300. So we're super proud of that. We're incredibly impressed. Honestly, with all the things you guys have built, did you guys know that most of the founders are all sitting together, already starting a village? Incredible. Well done. This is the QR code. There's also a bit.ly link underneath that if you're not familiar with QR codes. It is now time for you guys to vote. I personally am incredibly impressed with what these amazing women have built. So impressed to see what these products can contribute to the world. As a quick recap, there's going to be 3 awards. The first place award, we'll get that check that's over there. There's an audience choice award, which you guys are doing now. And then there's a runner-up as well. So take out your phones, take a picture of this. Seems like folks have done that. Everybody's taking a second. That's awesome. Great job. Awesome. So once you have voted, we're going to start to take a 10-minute break. That's a very quick turn. We are going to call you back here exactly at 10 minutes. So we recommend that you get drinks and snacks quite quickly and just come back to your seat. We have some impressive panelists coming up. The first one is the VC panel. If you're on that VC panel before the break, if you guys don't mind going to the back over there and just getting mic'd, the mics won't be on, so then you can take your break and get your snacks. That would be super helpful to us there. But yeah, now is the moment to stretch, get some coffee, make your votes, and we will see you back here in 10 minutes.